So we have Jake here back for visit number 2 after his evaluation. So I just haven't even greeted him yet. So I'm just going to find out kind of where things have been at since we last got together. So Jake, give me the report. What's happening?
Uh, everything's been tight lately.
Okay.
Still have some back pain in my lower back, and then
So what's changing? Is anything changed from the initial, or what's different?
I wouldn't say nothing has been too different. It's just that I'm pretty active, so then once I don't do the recovery work all the time, my body tightens up,
Sure.
and then I just get those aches and pains.
So
And then
with the homework, how often have we gotten that in?
probably like once a week or
Okay.
so. So I probably need to
So
ramp that up a
we're
little bit more.
well, we're 6 times behind. So
Yeah,
this needs to
yeah.
be as close to a daily routine. So when we're talking to PTs, the first thing that they're going to think about is nothing's changing. What did we do wrong? Do we need to change our program? The first is going to be how often have we been consistent with our stuff? I've been active. I've been continuing to do the things that have potentially been irritating it and haven't been doing enough of what I was supposed to be doing to get this right. So the first is going to be, all right, what did I do wrong? No, not yet. We got to figure out, is there something that we need to modify within Jake's program to figure out how to get him the result that he was looking for? So let's figure this out. Let's reach down for toes. Let's see what we got. And what are we feeling to bend at the moment? Is it mostly hamstring pull? Is it across the back? Is it kind of nerve pain? What are we getting?
It's about my back and then my hamstrings right here.
Okay. And then let's go ahead and rise. Any discomfort rising from that bent position or only when you're at the bottom?
Just when I'm at the bottom.
All right, widen the feet apart, come down into a squat. Any discomfort in the squat?
No.
Come back up. And then go ahead and have you lie on your back, head on the far end of the table. What I'm looking for is pain upon rising from that bent position is more going to be signs of instability. For us, that lack of mobility or discomfort or pain at the end is going to be either tightness or nerve-related pain. So the joint segment itself is not going to be as much of an issue. So it's going to be likely more soft tissue work, mobility, decompression, those type of things to try to free that nerve. So if we're digging into glute hamstring, we already know that's one of our bigger issues. So, all right, tense this thigh, pull the toes up toward us, resist me, don't let me pull you down. So we're maintaining strength here at the ankle, hold the great toe up, resist me. So we're maintaining strength here. So this is stuff that was not working well when we first got together. So even though Jake's like, nothing's really changed. Clinically, things have changed. So where he might be feeling down or feeling like, man, this isn't getting me what I was hoping for, well, clinically, we're already showing signs of some improvement. So this is something that we can help keep him motivated and keep him on the books and keep him coming so we can get the outcome that he was looking for. So showing them signs of improvement, whether they feel like things are changing subjectively in their kind of symptoms or not. Thigh tight, toes up, slowly lift this leg, stop when you start to feel it. Pain or just feeling?
That's it. It's just the stretch.
And it's all hamstring, butt, lower back.
Calf. Mostly calf right now. I'm a little bit behind the knee.
Okay, calf and behind the knee. Well, I mean, from day one, we're seeing signs that straight leg raise has gotten a little bit better. Tense the thigh, lift this leg high as you go. And no pains, no discomfort.
Yep.
So when we first got together, there was actually some crossover sign when we lifted the opposite leg. So when we lifted right, left side was causing him some grief. So again, signs that there's been some positive clinical improvement, even though he's feeling stiff and sore and painful. What are we getting here, Jake? Just stretch, or you have some pain here?
No, just stretch in my hip.
So the first thing I'm going to go to is just work toward releasing anything that crosses that nerve, because if we're seeing that nerve-related pain, I want to get to it. So I'm just going to pick up slack in it. This isn't increasing numbness or bringing anything down the leg. It's just stretching the glute.
It's stretching the front of the hip right now.
You're getting a little bit of a kind of front here,
I guess like right here.
You're getting more of this.
Yeah.
So what I look for is if we're getting anything in the front, that's problematic because we're so tight that it's actually going to cause a hinge of the hip and actually a pinch of the front of the joint. So the fact that that's not happening here is a great sign. We don't want to cause that pinch. I don't want hip impingement. We're not trying to traumatize any new structures. We're already in some discomfort here. We're not trying to create any new problems. So now I'm doing just a little bit of cross friction across some of these tight muscles. See if we can free it further. Not the most comfortable technique in the world.
No.
So that's all right to communicate that to your client as well, so they can understand, hey, look, some of these, we expect you to have some discomfort. You may have some soreness for a day or two after. If it sticks with you longer than 2 days, then you know we probably overdid it. Push out into my hand and relax it. Push out. Keep breathing and relax. So again, the classic disc instability is going to be those patients who hold their breath. So you're constantly trying to find, identify, and correct some of these things that they've habituated. So holding your breath is that classic kind of, I need to find stability in my spine through any means necessary. The problem with holding your breath is that it causes compression in your lower back. Drop the knees out far as you get. Let's take that from another angle. So that's our current situation, not optimal. So we know that this hip is being grabbed on for dear life. Any tenderness down the adductor here?
No. It's mostly like towards like the hip flexors right here, and then I guess, yeah, just hip flexors really.
So it's been a week, 2 weeks since we've been here?
I believe 2 weeks.
I feel this spot. So we're deep into the adductor right here and kind of found a spasmed point. So we're just kind of wait it out a little bit, do what's called a pressure point release. So anytime we find these kind of trigger points or areas that we can kind of have the biggest impact in releasing some of this range of motion. Take a deep breath, pull your knees up into my hand. And relax, let it drop. Felt it?
I felt my right hip just pop, like.
Pull up. And relax, let it drop.
Yeah.
Sure, what's happening when things are clicking, popping, locking?
Pull up. A few different things. For Jake, he's just living tight, so in some cases, relax. He wouldn't have popped previously. Now that we're actually working on some range of motion, gaining some range of motion, that joint mechanic is starting to change. So we'll go from a point of no popping to some popping, and then once he has freedom of range of motion, that popping will subside. So it goes from nothing to something back to nothing. So let's have a look and see where we're at. Still not perfectly symmetrical, but certainly improved in terms of where he's able to get to, just by spending a little time on it, getting a contract, relax, stretch afterward. So glute and adductor were our first attempts at some range of motion. So let's see that leg raise again, tense the thigh, straighten the leg, lift it high as you go. And what are we feeling at the end of this? Still more calf?
Yeah, still more calf.
And let it drop. Mobility did change to some degree. Rest the hands here. We're going to dig into this hip flexor. So again, that muscle runs from the front of the thigh through the pelvis to the front of the spine. When I ask you to lift it an inch, set it down in place. So just breathe, relax. So for clinicians, the thing that I want you to look for is if you're going to grade the depth of your palpation or how deep you're going to get to this tissue, like a grade 1 is just touching skin. The weight of your hand is now myofascia. Grade 3 is going to be 25% of the depth of the tissue. Grade 4 is 50% of the depth of the tissue. For me, I want to always start around a grade 4 to get to the 50% of the depth of the tissue to assess where we're at. Lift and drop. So we're doing kind of a grade 4 pressure point release here. Lift and drop. Sharp, shooting across, or just tender under my fingers. So why I ask if it's shooting is those tend to be a lot of trigger points called Jones points that just kind of shoot fire across the abdomen. And those are areas that you want to stay on and release. Lift and drop. How's this one compared to the last? Worse, better, same?
About the same.
All bad. Last one, up and drop. How's this one comparatively?
That was good.
Not as bad as the previous. Breathe. Lift. So I'm going to maintain that pressure while he lengthens, and that's going to actually assist in us gaining some length across it. So it's going to be sharp as you lengthen across it, and I want to maintain that pressure until it starts to dull out. So that sharpness, what you'll actually feel once you've done enough of these is that you'll feel that kind of muscle begin to melt a little bit after you spend a bit of time. So the normal is about 20 to 30 seconds. Sometimes it's up to 2 to 3 minutes. So you gotta kind of get your hand strength up to be able to do a lot of this stuff. Is that dulling out, Jake, as we spend some time here? So, take a deep breath. So that's your sign. So we can actually downregulate the nervous system of having that muscle kind of being so tense, because if we just go straight into stretching, it's not going to be anywhere near as effective as if we downregulate the nervous system and then get into the stretch. Come close to this edge of the table. Hug this knee to your chest. Grab it, hug it, pull it up. Which is why I did that pressure point work with his adductor, why I wanted to do that pressure point work with the hip flexor. Gently pull this knee up into my hand. Keep breathing. So when we do that contract, relax, the other thing we got to look for is making sure that they're not bearing down and breaking some of that habit. Pull up and drop. Pull up and drop. Good. Let's move back to the middle of the table. Straighten the legs out, toes up, lift the leg high as you go. And what's that feeling like to lift compared to last you did it?
Nothing.
Okay. Work towards straightening this knee. Just stretch.
Yeah, I just stretch my knee.
Not the nerve pain that you had previous. Good. Lie on your side, face that way. Lift the leg, straighten it, hold it. Do not let me pull this leg down, resist my pressure. Getting stronger, but still wants to buckle. So come close to this edge of the table. So when we see weakness here, my typical go-to is actually to try to free and make space for kind of some of the nervous system in that lower lumbar spine. So I'm going to take him into just kind of a lumbar roll position posture. We're going to roll this back. Any discomfort, any pains?
No.
Just muscle stretching.
Yeah.
Take a nice deep breath for me, Jake. And blow it out. Let's get back to this middle position. So for me, it's hold it, don't let me pull you down. And how's that feel, Jake, compared to last you did it?
Better.
So the reason I want to take him into some flexion with this top leg is I'm actually going to now get to a little bit of flexion of the lumbar spine. And then once I gain rotation, I'm kind of rotating the trunk down until I feel these segments gap. I'm taking the knee up. So for me, it's taken a while to get to kind of where you don't have to align this. The very first times that you do this, you're almost going to want to palpate kind of the inner spinous space and actually palpate the spinous process and have him rotate. And once you actually feel these segments begin to move, that's when you know, all right, I'm on it. I've picked up the slack from the lumbar. When I bend this up, then I know, all right, I've bent this knee far enough to actually feel some flexion here. So I know I'm really having an effect at these kind of inner spinous space levels. So having done this enough, you kind of know where to go, but the very first times you're actually going to palpate and feel those inner spinous spaces and then gain that rotation into it. The goal isn't necessarily a cavitation or a crack or an adjustment to it. We're gapping, we're giving space to the nerve. So if you don't get a crack, don't worry. 9 times out of 10, you go back and retest. Just by gapping that space, you're going to see that you've gained strength. Lie on your back. Toes up, lift this leg once more. And how does that feel compared to the last we did it?
Good. Really good.
Gain some range here.
Yeah.
Cool. Lie on your stomach. Activation of the posterior chains looking, so that usually is related to even higher segments of the spine. So lift this whole leg up. Any discomfort in the back?
No.
Lift and hold it. Don't let me pull you down. Resist me. No problems here. No pain.
Okay.
Bend. Hold it. Don't let me straighten you. Good. So everything's testing nice and strong here. Any tenderness in paraspinals here?
Yeah, the first spot that you had, yeah,
Right
right
here?
there.
And you feel a difference between left and right, or they feel about the same to you?
The left feels worse, more tender.
Okay. So when we have issues where injured side has higher kind of output threshold, more tenderness, more irritability, you feel kind of that muscle's physically a little more dense, then we have to free a little bit of that nerve output. So same deal, I'm actually going to rotate until I feel that segment move. Take a nice deep breath for me and full exhale. And then let's have you stand. If it's strong, there's really not going to be a big post test for me, but freeing up any of that nervous system chain should help. Reach down for toes again. Let's see what we're dealing with here. How does that feel to bend?
Better. Now it's just a stretch.
Come back up. And you can see that was a whole lot more fluid. Initially, it was very guarded and slow, and that looked a lot freer. Yeah. So let's check some core muscles. Lie on your back, head up on that far end of the table. Bend both knees, toes up. Arms across your chest. Lift your hips an inch or two off the table. Any discomfort to lift?
No.
Keep your hips up, lift this foot off the table. And set it down, so you don't have to come up quite as high. Just clear that heel from the table. Up and down, go back and forth here. So what I'm looking for is just hip stability. When he lifts one side, I look for that side to be able to maintain it. If he lifts the left and the left drops, it tells me rotational core stability isn't where it needs to be. Any discomfort to lift either side? And it feels pretty equal strength-wise? Mm-hmm. Keep marching. And we're looking reasonably decent here. Nothing more to kind of say, aha, that's our big go-to. Come down. So where should we go from here? It could be either continued soft tissue, it could be cupping, it could be instrument-assisted soft tissue along some of these areas, or it could be just jumping on the inversion table and then working on some modalities. Should we jump into a whole bunch of new exercises if he hasn't been through in 2 weeks and has done his exercises one time? Probably not. So where do we go? Show me the homework that you did work on. Let me just double check your technique and make sure we're good. What we don't want to do is advance him past the point of what his capabilities are. Strength looks good with bridge with march, so it may be that we've gotten him enough comfort where we may be able to replace some of his initial exercises because some of the manual hands-on things have actually gotten us further down the chain rather than his home exercise program. So let's get on the inversion table, tip you upside down next. So Jake has struggled with flexion. We've freed up a lot of what's happened kind of around his lumbar, hip, hamstring complex. So when he bends, he no longer feels any of that up the chain. What he feels is kind of behind the knees. So there's a few usual suspects back here that can actually prevent you from getting full flexion range of motion. And what we're looking at right now is that top cupped area is more where popliteus and plantaris muscle cross. So there's some nerves that kind of pass this area, and if it's wound up tight, it's going to actually tug like mad when he bends over. The second area that we look for is just behind the fibular head, so we're going to hit that next. So we're going to assess, we're going to treat, we're going to retest, and if nothing changes, we're going to hit this kind of nerve tissue on either side to see if we can't free this up even a little further. So got to be a little scientific in your approach. You can't just shotgun everything like you see online, where you see 71,000 cups on somebody and say that we made a difference. If we can be very targeted and be a little more like a sniper than somebody blasting a shotgun, then we can do a whole lot more good than harm, which is the ultimate goal. All right, let's get on your feet and retest. I don't know how many insomniacs there are in the house, but you might have seen the sciatic nerve knee brace at 2:45 in the morning on some infomercials. And this brace actually has a little nodule that pushes in right behind that fibular head to alleviate what they say is an acupressure point for sciatic nerve problems. So, surprise, surprise, if we treat it, we can affect the sciatic nerve. All right, one more time. Did that change? Okay. Cool. All right, we got to lengthen out that posterior chain, so a couple new exercises we may think about, just hanging heels off of a slant board to free a lot of his calves to see if we can't get that nervous system to function a little bit better as well.